Thanks for staying with us. Now, will the COVID-19 pandemic soon be a thing of the past in South Africa? While the virus seems to be slowly losing its grip, the country's been recording less than 700 new daily cases this week. But we're not out of the woods just yet. There have been reports of new respiratory viral infections. To paint the picture for us, we now speak to Professor Adrian Puren, who's the Acting Executive Director of the National Institute for Communicable Diseases. Thank you so much for your time, Prof. We do appreciate it. Now, there are 4 viruses currently doing the rounds. These include RSV, influenza, and measles. Perhaps just tell us how serious these all are and what the picture looks like in the country at the moment.
Yes, so over the past 2.5 years, I suppose the dominant virus has been COVID-19, and in fact that has displaced respiratory viruses, RSV, for example, and influenza over the last 2 years. However, we're seeing the classical picture. In other words, we certainly have seen an early season, as always, in terms of RSV. And this primarily affects young children, especially below the ages of 5. And so we certainly have seen a initial marked increase in that particular virus in circulation. However, one of the major concerns was, in fact, that because there was this immune gap over the last 2 and a bit years, that in fact we may see a worsening of that particular scenario compared to previous years. However, this is not really panned out. In fact, we now see that, in fact, there is certainly declines in the numbers of RSV cases, and in fact there's been no marked pressure in terms of hospitalizations. The other virus that is now in circulation is influenza as well, but the season again seems to be a mild to moderate in terms of what we have seen previously, but there's still an upward trajectory and there's still a few months to go. And as you know, influenza really spreads in terms of close contact, and children as well are an important means of transmitting from person to person. However, we are in the midst, I think, of the school holidays, so that may well give us a little break around influenza. But I really would like to encourage people, nevertheless, to be vaccinated. I think there are influenza vaccines, or there should be vaccines available, not to the same extent as for COVID-19. But again, I would really like to encourage high-risk groups, young children, older adults, pregnant women, for example, and those that have cardiac disease or lung disease, to be vaccinated around that. And then you mentioned COVID-19, which, as you know, has really dominated our lives. Certainly, yes, we're not out of the woods yet. It's still in circulation, still in transmission. So again, I think I know that mask wearing and so forth has certainly been uplifted, but again, individuals should really monitor to their risks. Again, really encouraging people to be vaccinated, either individuals who have not been vaccinated or not fully vaccinated or have not had their boosters, really to encourage those individuals. Because again, we don't know how this particular pandemic will evolve.
I want to ask you if you still believe that those who are not vaccinated against COVID-19 still remain the most vulnerable.
I think relative to individuals that have not been vaccinated, yes, I think they are more vulnerable in the sense that I think the vaccines certainly add a level of protection against severe disease. So yes, you will be infected even though you may have been vaccinated, but I think the effect of the vaccine is certainly to protect against severe disease in terms of hospitalizations and death. So really, one would really encourage those individuals who have not been vaccinated to vaccinate. I know that South Africa has experienced a large or significant degree of so-called natural infections. But again, when you look at the variants that are in circulation, especially the current variants, the level of protection may not be to the same extent in vaccinated individuals, but it certainly protects against severe disease. I would encourage individuals to be vaccinated.
Let's stay with the issue of COVID-19. And if I'm not mistaken, Prof, we do know that there's now a new subvariant of Omicron. I don't know why this variant does not want to leave us alone. But apparently it's Omicron BA.5. Should we be worried? And do we know if this variant is currently in South Africa? And what is it like? Is it different to the other subvariants that we've seen with Omicron? And should we be worried?
So again, in terms of the BA.4 and BA.5, these are in high degree of circulation in South Africa currently. And in fact, we've seen a season that's very different from the previous variants in terms of the seriousness of this disease. So it's ongoing. And therefore, I think we still expect to see, as I said, a degree of protection against severe disease, at least. Certainly there'll be levels of reinfection, for example, or individuals that have not been exposed will be infected. So I think it's really important, again, just to keep an eye out. I think we are seeing lower levels of testing, but certainly we've seen a marked decrease in terms of the so-called positivity. And I think people are not testing, but again, I'd like to encourage individuals who do present with signs and symptoms that may suggest that they may have COVID-19 if they don't intend to test, but at least go into isolation, for example, as we would encourage people to do when they have the common cold or influenza, just simply to isolate and not expose others to this particular virus.
And then, Prof, as of yesterday, the NICD decided to no longer report COVID-19 surveillance data. What does this actually mean, and why was this decision taken?
Yeah, so the National Department of Health will release a more fuller statement around these types of decisions. I don't want to preempt that, but I think if you look at the worldwide trends, for example, we're really looking at moving averages very often rather than the day-to-day review of data, because that does not influence certain decisions. So a decision around the MPIs, the wearing of masks, for example, is not going to be influenced by an event on a specific day. You're really looking at trends. So I think those are the types of decisions that governments have already taken and are taking in terms of the reporting currently.
Prof, I'm going to put you on the spot, and I hope you can provide some clarity. I think South Africans are slightly concerned. We've seen another case of monkeypox reported in Limpopo. We've just seen the health MEC there releasing that statement. What does that picture look like? Should we be worried, and how many active cases do we have of monkeypox in the country at this stage?
Yeah, so if the Minister in Mpumalanga has released that, so that will be the third case in terms of the cases in South Africa. So I think for the general population overall, I think the risks are moderate to low, in fact. The exposures, again, are face-to-face contact, close skin contact, and those particular settings are really critical for the transmission. And so my sense, again, for this particular time is that I don't think we should be concerned. We should not be in a panic state. There are ways in which we can manage this. So I'm sure if that announcement has been made, that in fact the initiation around contact tracing, both forward and backward tracing, will take place to really try and limit transmission. I think that's going to be key for South Africa, and I think many other countries as well. Is really the contact tracing will be a key component to ensure that we can try and limit the transmission of this particular virus.
Okay, great. Thank you so much for your insights. We do appreciate it. That was Professor Adrian Puren from the National Institute for Communicable Diseases.